You bring all the good info. I'm telling you, last time you were here, you just shot out some symptoms that made us all think, because there are things I think we think about all the time. It's just being normal, especially for a woman.
And or another way to look at it is there are tons of things that we just don't think about that we should be thinking about.
Absolutely. And a lot of the statistics that you gave us had to do with women. Now, I'm going to ask, and this may be a dumb question, but does the woman's heart differ physically than a male's heart?
You know, in many ways, a female heart is often smaller. We have vessels that are smaller. The heart beats a little bit faster, but still has to pump the same amount of blood. So in some ways, there's more effort. And, you know, that comes together with something that we call microvascular disease. So a lot of small vessels in the heart that oftentimes go unrecognized with our standard cardiac workups. And it's those small vessels, microvascular disease, that women are more often going to be subjected to and can give you sort of those vague symptoms, chest pain, where nobody can figure out the reason
what's going on.
That's right.
And it's really our heart's just working harder than the men's.
That's right.
Isn't that shocking?
That's right. It's a little harder, and we've got smaller vessels. I mean, isn't that the story of our lives? We're always working harder with less. We've got to do more with less.
And not even recognize what's going wrong in the first place. So that makes it very difficult, but so crucial, because it is the #1 killer of women. The smaller vessels, does that kind of come into play once you do realize that's what's going on, when you go to diagnose and then actually treat it? Does that make it harder to treat?
It does make it harder to treat because it's harder to recognize. We still don't have gender-specific therapy and diagnostic tools for women. I talk about this all the time. So it's sort of a one-size-fits-all. You know, here's all the research that was done on men. Here's all the data that we have on men. And here are the tests that we know work on men. But we extrapolate it to everyone. We don't think about it that way. We think about it, here are the tests that are done, here are the research that is done, here's the data. Why isn't it working for everybody? But we don't even ask that question. We don't ask why isn't it working. We say, it's working great for everybody.
For everyone, exactly. But it's not the case.